이루어집니다. 안녕하십니까. Hello, everybody. I see many familiar faces here. So, we just want to share with you some of the updates very quickly. And we'll have a two-case demonstration for the under the eye back area and the A-type cannula thread. So let's see. We have some updates. Okay, so now I'm sure many of you know already the video thread and you know many types of other thread. So nowadays in Korea, most of the thread is what we call mold type cannula. So mold type cannula and many different design, and also now we have called emboss or super emboss. The meaning is the cork is inside the thread. I mean the thread is like this. Okay, I'll tell you once more. Difference between the cork thread and mold cork and the emboss mold. Okay, well, I'll tell you one more time. Okay, so this is the cork thread. As you know, cork thread, if you have the thread and you cut to make the cork, so you can think the area which cut to make a cork, the area of the cork become weak. So when it become weak and when they absorb, when they melt, which one will melt first? This shaft or the cut cork? Cut cork. So usually, previously, I mean 2 years ago, 3 years ago, if you use the cork thread alone to make a lifting, usually 4 months, 5 months, drop down, come back to normal. But the whole thread, of course, melt 6 to 8 months. But you can see here the mold thread. There is no cutting. There is no cutting, but on top of the thread, you have additional spike, additional cork. So this one will not melt at the cutting point like a previous cork. But the problem is, thread becomes so thick. Okay, so thread usually very thick. So if you don't have a good skill, sometimes you get the protrusion, the dimpling, you have this symmetry, lines. So this is the problem. So after that, this mold thread, but we call it emboss mold. So you have the shaft and you go this pattern. So this will less create the dimpling and less the lines appear because of this shape. But now we have another thread called the super emboss. Means you have the thread and the cork is inside. So we also call it inner cork. So inner cork also create less dimpling, but sometimes it's difficult to hold the skin. But with our technique, don't pull too much, then usually there is no problem. And then, so these are the inner corks, super embossed, which you call super embossed. And then, now is the new era of the octo twist, which is the braided thread. Okay, we have PDO, we have PCL, we have braided thread. It's beautiful. And because of this pattern, they stimulate a lot of collagen in between the threads. You remember a long time ago I showed the cross section of the thread? The collagen stimulates surrounding the thread. But octo twist means 8 threads twist each other. So you can imagine along the 8th thread surrounding the thread you have the collagen stimulation. So it is nowadays this octo twist is used not only for the collagen stimulation technique of lifting, but used for the filler. Can you imagine the thread? We call it thread filler. Especially they are very good here, and also the globular wrinkle is fantastic. Globular wrinkle, and also this long wrinkle, which let's say you are 60, 70 years old with a very deep wrinkle, cannot solve with the Botox, cannot solve with the filler, then you can try the octo twist. It's very good. Okay, so these are the new thread. Of course, we have another new one actually. We call it double mold thread. Usually, the thread come up cannula, something like this, right? Something like this. But double mold means you have one more line, long line. So you have a one outside with a molding cork, or one inside embossed mold. So this is what we call double mold thread. Can you see it here? Yeah, one inside embossed mold, outside cork mold. So you are putting the 2 mold thread in one cannula. So actually, Ultra-B released first time in the world, first time in Korea. This double mold thread, PDO, PCL. It's fantastic. And we also have an elastic mold thread. Elastic means the thread is like a rubber band. So we pull up like a rubber band, and then we can tie here. Some people like this anchoring technique, can use it. So Ultra-B released actually so many new type of thread, first time in the world. So these are the different type of thread which I show to my patient and let them choose. Of course, the new one more expensive, more better, more expensive. Okay? But it's important that you have to show your patient that you are doing something new all the time. This one you know already, so I will just pass. I will just show you the difference between the cannulas. Okay. To put the thread, as you know, we need a needle or cannula. So if you have a good quality of cannula, also the result is different. So this is the most commonly used cannula nowadays everywhere in the world. L-type cannula, mean it's a half blunt. Can you see here, half blunt? And this is a commonly also used before when we use the filler. So this is called totally blunt, so we call it W type. Okay, so let's talk about these 2 types. The L type and W type which is much easy to go in when you put the cannula. L type is more easy to go in. Okay, then what is the usual problem of the L type? It's easy to go in, but what is the usually problem of the bruising? Yes, because it's a little bit semi-sharp, so it's more painful. More painful, and of course, they will hurt more blood vessels, so more swelling, more bruising. So many people, some people use the W type. This is a totally blunt one. Okay, totally blunt one. What is the advantage of this totally blunt one? Advantage. Less bruising. Yeah, that's correct. Less bruising. Yes. Less pain. Because it's at least it's blunt, right? But then what is the usual problem? It's difficult to put in, especially those patients who have a very fibrotic skin underneath, who did many treatments before, who did the thread before, who did the Ulthera before, who did the filler before, especially like a Sculptra, very fibrotic fillers, Elancet, very difficult calcium fillers, super difficult. So what happens sometimes? You want to put them in with the power, and at this point, sometimes it breaks. Okay, so you have to be very careful. So I always tell you in our trainings, do not put the thread with too much power, and do not manipulate the cannula like this. This is not really a good technique, especially when you are doing like this, what happened? Do you remember when I give you the tips? Always the cannula should be beveled down. Remember? Beveled down. It's very important. I tell you, before I mention, no other Korean doctor will mention about these things because they don't even know the importance of the bevel up or down. You got it? Okay. If you make the bevel, suddenly you are doing it and the bevel going up like this, what happened? The most common problem. The thread becomes too superficial. And especially when it's with the cork. And you pull. Dimpling. You get more chance of the dimpling when you put the bevel up with the cannula. Once you have this dimpling, sometimes it will make you headache for many, many days. Because patient will call you, I have this dimpling, when this will go away. You will tell them, oh, just do some massage, they will go away. But sometimes they stay there one month, 2 months. That's why I always tell you, when you do the thread, you should be kind of a perfectionist. If you make any mistake, that will make you headache for a long, long time. Okay, so A type here. You can see all the good advantages of the both L type and W type. Because it's at the end, can you see it's semi-blunt? So it's very easy to go in, but because it's at the end is the blunt, it will less cause bruise or swelling, hematoma, much lesser. So many of the doctors who start using A-type cannula, they don't want to do L-type or they don't want to use other type of cannula. So anyway, these are also very important things. The cannula is also very important to make less problems. Okay, but still keep level down when you're going into the skin. So pain, A-type. Pain less, insertion easy, swelling less, hematoma less. So this is one of the newest cannula. Also again, first time introduced by Ultra V in Korea. Ultra V introduced first time in Asia, in Europe, Australia, and